As countries try to get booster rates up to deal with Omicron, WHO chief warns the world cannot boost its way out of the pandemic. Marvi Delfin will tell us why live. Yes, Marvi, good evening.
Good evening, Marielle. In a media briefing last night, WHO Chief Tedros insisted that the focus of immunization must remain on decreasing deaths and severe disease, while also expressing concern that blanket booster programs will exacerbate inequity in global vaccine access. As the Omicron variant dominance threatens festivities across the world and governments in wealthy countries speedily rolled out booster campaigns, WHO Chief Tedros warned that third doses did not translate into a signal for celebrations.
Blanket booster programs are likely to prolong the pandemic rather than ending it, by diverting supply to countries that already have high levels of vaccination coverage, giving the virus more opportunity to spread and mutate. It's important to remember that the vast majority of hospitalizations and deaths are in unvaccinated people, not unboosted people.
According to the recently released interim statement of the WHO and the Strategic Advisory Group of Experts on Immunization, or SAGE, many countries are still far from reaching the 40% coverage target by the end of 2021, while other countries have vaccinated well beyond this threshold. Moreover, 120 countries had started implementing booster programs for a third or even a fourth shot in the case of Israel, but not one of them is a low-income country. While UN figures suggest that about 67% of people in high-income countries have had at least one vaccine dose, but not even 10% in low-income countries. There is now a renewed call for manufacturers and other countries to prioritize the COVAX program to get doses to needier nations and work together to support those who are furthest behind. But the WHO chief remains hopeful that 2022 will end the pandemic, given the increased knowledge of the virus and effective tools to combat it, with the addition of comprehensive implementation and equity. Marielle?
Marvi, what is the WHO's recommendation for the administration of an additional dose?
Marielle, WHO and SAGE recommended on Wednesday that additional doses should be targeted to the population groups at highest risk of serious disease, such as older adults and immunocompromised persons, as well as those necessary to protect the healthcare system. The WHO reminds that vaccine booster dose policy decisions should be based on evidence of individual and public health benefits and obligations to secure equitable global vaccine access. Back to you, Marielle.
Thank you, Marvi Delfin, reporting live from Australia.